Kidney failure, also known as end-stage renal disease, ESRD, is a serious medical condition where the kidneys lose their ability to filter waste and balance fluid levels in the body, leading to a dangerous accumulation of toxins. Patients with kidney failure may experience symptoms such as fatigue, swelling in the limbs, shortness of breath, and an inability to eliminate waste properly, which can cause a buildup of harmful substances in the blood. In contrast, Ozempic, semaglutide, is not a disease, but a medication used to improve blood sugar control in adults with type 2 diabetes, and it can also contribute to weight loss. The treatment of kidney failure often involves methods like dialysis or a kidney transplant, while Ozempic is administered as a prescription injectable medication. Risk factors for kidney failure include diabetes, high blood pressure, and chronic kidney disease. Whereas for Ozempic, the primary risk would be prescribing it to individuals with a history of pancreatitis or allergic reactions to its components. Here's a more detailed look at the aspects of kidney failure and the role of medications like Ozempic in managing other health conditions. Affected organ systems, renal versus endocrine. When considering kidney failure and the effects of the diabetes medication Ozempic, semaglutide, it's crucial to discern the interplay between renal and endocrine systems. Kidney failure, a condition where the kidneys lose their filtering ability, can have devastating consequences, including electrolyte imbalances, waste accumulation, and fluid imbalance. Meanwhile, Ozempic, an antidiabetic medication, works on the endocrine system, enhancing insulin secretion and delaying gastric emptying, which can be beneficial in managing type 2 diabetes. However, Ozempic must be used cautiously in patients with renal impairment, as its clearance is kidney-dependent. Unmonitored use might lead to drug accumulation and potential toxicity, further exacerbating kidney function. Thus, careful consideration of kidney function is essential when treating diabetic patients with Ozempic to avoid unintended renal complications. Symptom onset, gradual versus medication-induced. Kidney failure typically manifests gradually, its symptoms slowly progressing as the kidneys lose functionality over time, edema, fatigue, and changes in urination being some telltale signs. However, the differential diagnosis can be perplexing when considering a medication like Ozempic, a drug used to manage type 2 diabetes. Ozempic has potential renal side effects due to its action on blood sugar and body weight. Unlike intrinsic kidney disease, any kidney impairment caused by Ozempic might closely follow the start of medication, presenting a challenge in determining whether symptoms are medication-induced or indicative of an underlying chronic condition. Constant monitoring of kidney function is imperative for patients on Ozempic, as distinguishing between the two by the timing of symptom onset can be a critical step in providing appropriate care and avoiding further renal damage. Primary dysfunction, filtration versus insulin regulation. Kidney failure and the use of medications like Ozempic, semaglutide, present a nuanced interplay in the realm of disease management. While kidney failure denotes a critical decline in filtration capacity, impairing the body's ability to expel waste and maintain fluid balance, Ozempic operates distinctively, targeting the dysregulation of insulin. As a GLP-1 receptor agonist, Ozempic enhances insulin secretion and suppresses glucagon release, pivotal in controlling glucose levels in diabetes. However, its administration requires carefully considering renal function, as impaired kidneys may affect the drug's pharmacokinetics and necessitate dosage adjustments. Thus, while one primarily combats a fundamental filtration issue, the other intricately tweaks hormonal pathways to regulate metabolism, with each condition and treatment needing vigilant cross-evaluation to ensure patient safety and therapeutic efficacy. Common causes, chronic conditions versus pharmaceutical. Kidney failure, a serious condition marked by the cessation of adequate kidney function, often arises as a complication of chronic conditions like diabetes and hypertension. Medications such as Ozempic, semaglutide, utilized for blood sugar regulation in type 2 diabetes, might paradoxically affect kidney health. While Ozempic generally benefits kidney function by improving glycemic control and potentially slowing diabetes progression, it may also lead to rare side effects, including acute kidney injury, mainly if dehydration occurs or if used in conjunction with other nephrotoxic drugs. This juxtaposition highlights the complex interplay between disease management and pharmacological interventions, where drugs can be both therapeutic and potentially harmful to renal health. Treatment approaches: dialysis, transplant versus dosage adjustment. Kidney failure demands meticulous management to maintain bodily functions, which can be disrupted by medications like Ozempic, semaglutide, used in type 2 diabetes treatment. While dialysis or transplantation is necessary in severe renal impairment, Ozempic requires dosage adjustment to prevent drug accumulation and exacerbation of renal damage. Clinicians face a delicate balancing act, ensuring adequate glucose control while avoiding further kidney injury. The challenge lies in individualizing treatment, regularly monitoring renal function, and adjusting dosage with precision, highlighting the intricate relationship between pharmacotherapy and organ health. Patient-specific factors dictate strategy, often mandating a multidisciplinary approach to optimize outcomes for those with concurrent diabetes and renal failure.